In this section, I'm going to speak about Master Tung's points for occipital headaches. And keep in mind that these points can also be used for cervicogenic headaches. So if there's problems within the cervical vertebrae that are contributing to headaches or migraines, you can use these same point groups. Okay? The first group of points that I want to speak about are the ones that are on the Achilles tendon, and these are numbered 77.01 through 77.03. The first point is located between kidney 3 and UB60, right on top of the Achilles tendon. And then the second point is 2 cun above that, and the next point is 2 cun above the second point. These are needled as a set, so when you needle them, make sure that you do all three of them. And you want to use deep needle penetration with these, so I suggest needling about 1.5 cun into it. Now, when you do these points, you want to do these on the same side as the pain. So if it's unilateral pain and you're needling these, needle these on the same side. Now, I know I've been going on about how important it is to needle on the opposite side of the pain when treating migraines and trigeminal neuralgia, but that pertains to local points, okay? So because these are distal points and they're on the same line, on the bladder meridian or the myofascial line that you see here, we needle these on the same side. Now, in the balance method and in the Master Tung protocols, typically what we're going to do is we're going to needle these on the same side as the pain, and then on the opposite side, on the hand, we can needle SI3 and another point that's 22.09. So in the Master Tung system, SI3 is known as 22.08, and then there's another point, 1.5 cun proximal to it, it's 22.09, and these are needled together as well. Typically how I begin when I'm treating one-side occipital headaches is to needle 22.08 and 22.09 together as a pair on the opposite side, and then I'm going to do something on the superficial back line as well. And these points here, the Achilles tendon points, work wonders. You can do those. And there's some other options that we have as well, though. There's another group of points called the 7 tigers that are located in the UB58 to UB60 area. I may needle those. That's another 3-point set that is indicated primarily for pain more in the upper back and between the scapulas. But I do find that I can use those for some patterns of occipital headaches. And I do often like to combine those 7 tigers with these. Now, what's similar between these Achilles tendon points and the 7 tigers is that they're both on the superficial back line and they're both distally located, okay? And if we look ahead here, we find that another protocol for treating occipital headaches in the Tung system is to do bloodletting on points in the mid-thigh area and down to the lower leg. So in the mid area of the hamstrings down towards UB40 and down through UB57. If you observe blood stagnation signs in that area, you can do bloodletting there, and that is a method of treating occipital headaches as well. What I've found in my practice is that there are many different point groups on the bladder meridian or on the superficial back line that we can use for treating occipital headaches, okay? So when you're treating them and they're on one side, start with small intestine 3 and 22.09, and then on the same side as the pain, you can do the bladder points. Now the next point that we see here is this point that's on the little finger, on the knuckle. It's distal to SI3, and you do find that this point can be used on its own. So you can needle all 3 of these points together, or you can just needle this one point. I don't start with that, and I don't start with finger points. I like to do finger points in later phases of treatment or after I've already seen the client 5 or 6 times. I do like the finger points, though, if it's related to a bone-related condition, or if there's arthritis in the cervical spine, or if there's neurodegeneration or a neurological problem such as a disc herniation or nerve impingement, then I may needle those, or I may add that point to these 2. Or I do like them for degeneration or osteoporosis. And these finger points then can be quite powerful for those. However, they're typically not what I start with, unless there are bone-related conditions, arthritis, neurological problems, or degeneration of some kind. Now, keep in mind when needling these hand points, you shouldn't be doing all of these points together. These points here in red on the small intestine meridian, they constitute a group of points. You can do all three of them together, or a lot of times you can just do small intestine 3 and 22.09. That's enough with the bladder points, okay? Now, another group of points. Let's say that I've needled small intestine 3 and 22.09, and I've done that a few times. Then I may stop doing those if the patient reaches a plateau. Let's say they're progressing and then I do a treatment and then they don't feel any better, then that tells me it's time to switch my points. Now, I could either switch to these points here in the middle finger. These are known as 3-finger spine. The way that you find those are the first point is in the middle between the knuckles, and then the other points are in the middle between the knuckle and that first point. So you can do those 3 points, and that constitutes a treatment on its own, just doing those 3 points. Now, you are going to want to continue to combine those with something else going on the bladder meridian or some other points on the other limbs, but these 3 points are done as a set, okay? And similar to the Chi Hua point, so Chi means 7, and then we find these 7 points on either side of the knuckle, on the index, middle, and ring fingers, and then on the inside portion of the pinky fingers. So please don't try to needle all of these together. Your patient won't like that, and it's just not necessary. You'll overstimulate them. It's not nice. So just pick one of these groups that you see here, okay? You can do the small intestine group, or you can do the group on the middle finger. You can do the 7 points on the knuckles, or you can do this combination of Lingu, Dabai, and Fanhoji. I do like these 3 points, and they treat all kinds of headaches. You can use those for liver pattern headaches, frontal headaches, occipital headaches, and they work wonders. Now, you may have needled these points before and gotten good results. You may have done those on a client several times, and then they stop responding, and then you can switch to using another group of points that you see here, okay? For occipital headaches, though, I'm usually starting with the small intestine points, or I will use these depending on their overall signs and symptoms that are present, okay? These are just so effective for pain in general, as most of us know, and they are used as a set of 3 points in the Tung system as well. Okay, so I think that's everything I want to say. Some of the other points that are used in the Tung system are on the sacrum, and you can needle directly under the spinous process of the sacral area, or you can needle on the sacrum over the openings where the nerves come out. So sacral points can also be used for treating the occipital headaches as well. Now, I don't needle those. It's very rare that I do because I get results with other points, and I just don't like to have my clients undress so much most of the time. I may needle them in a non-responder, or if they have a problem in the sacroiliac joint, and I've done a lot of distal needling and they're hypo-responders and they don't respond that well, then I may needle those. And by needling those, you can get a nice craniosacral effect though as well. So, you do want to add them to the mix when needed, but it's rare that I needle those points anymore. I used to needle them more frequently when I was doing more of a TCM style. However, I just typically don't need to do those any longer. Before we move on to the next point though, I do want to show you this diagram here because it helps to explain some reasons about why we get results with these points and why we don't get results with these points. So in the image on the left, you can see the myofascial lines. This is the deep back arm line, and then this is the superficial back line here that we see. So the points that are on the small intestine meridian, they're able to affect this deep back arm line, and we can see that the levator scapulae is on this line as well. And the levator scapulae attaches to these upper cervical vertebrae. So when you needle a point like SI3 and 22.09, it is able to reach these upper vertebrae through this myofascial line. However, if we think of this from a neurological perspective, then when we needle those points, it's going to be affecting the C7T1 region through the myotomes, okay? So it's affecting this area. So that's why these points are so effective for neck and even shoulder pain and occipital headaches is because it's really affecting this whole area here. Neurologically, we can trace the nerve roots back to C7 and T1, so we're going to get a neurological response through there by needling them. And then it's also going to be reaching the upper cervical vertebrae via the levator scapulae. Now, there are times, though, when you needle these points and a person has a problem up in C1, C2, C3. If they have a problem there and they're not responding to these points, or you've reached a plateau, perhaps you've got them 60 or 70% better and they're really happy with that, but they're continuing to come in and see you, and then they plateau out. What you're going to want to do in those phases of treatment is shift to your ear points. Okay, because if you needle these points in red that correspond to the cervical region in ear acupuncture, when you needle those points, it's going to affect the great auricular nerve and the lesser occipital nerve. And remember that these nerves are emerging from the C2, C3 area. So if they have a diagnosis and they know that the problem is in the C2, C3 region, then adding those ear points can be very beneficial. Now, I've been going on about how important it is to treat the opposite side to start with for a lot of these conditions, and especially when it's related to the trigeminal nerve. But in my experience, when it involves the cervical nerves, I do find that I am needling on the same side more frequently, and that there is a lesser chance of having an adverse reaction. Now, I may still start on the opposite side, depending on how many times I've seen the client, depending on how sensitive they are, and depending what the ear probe shows me, okay? So you can needle these on the same or the opposite side, and I have had numerous cases where I was able to get the client at a higher level of recovery by needling these points either on the same side or the opposite side. And I do like to typically reserve those for more later stages of treatment. Now, you can also begin with them. I just like to isolate my point groups out so that I know what points are doing what. And, if you start with ear points and scalp points and points on the hands and the feet, and you've done 12 or 15 or 20 needles, then you're not really going to be sure what points are working best. And so by isolating your point groups in different ways, then you can better determine what points are most appropriate at any given time, okay? That's why I like to do that. So needling these ear points are a way that we can reach those upper levels of the cervical vertebrae, and we can even pair those with the SI3 point and 22.09 to get a more pronounced effect. So when you do that, these points are going to be reaching levator scapulae and getting that area, and then if you plug in the ear points, that's going to provide another angle to reach those upper cervical vertebrae and the nerves through there. And then when you combine them with like the points on the Achilles tendon, you're going to get really good results that way. The next point here reads kidney depletion. So here's a point protocol that James Marr lists for treating kidney pattern deficiency headaches in the occipital area, and that's to needle SI3 with 22.09. So these 2 points again, and then Shui Tong and Shui Jin, which are 10-10-19 and 10-10.20 in the Tung system. We've talked about these. I just want to quickly review these, because we did talk about how these points can be used for deficiency patterns. Remember that the points in the maxillary area are treating more excessive type conditions like cystitis and kidney stones, whereas these points, 10-10-19 and 10-10-20 on the lower side of the lip, these are more for the deficiency conditions or kidney lung patterns occurring together. So this is a nice little point prescription that you can use for occipital headaches as well, needling SI3 and 22.09 with the points just below the lip. Okay, and then Marr also says that you can use these points for patients with osteoporosis, and we talked about how needling some of these points on the face can be used for treating the kidney stones, but also when these are used for osteoporosis. I suspect that there's a similar mechanism of action that is occurring through calcium regulation and through the modulation of the parathyroid hormones and its role in calcium metabolism. Okay. The next point here reads, assess the structure from the feet to the knees, the lumbar region, the thoracic area, and the neck. When you're treating occipital headaches, it is important to also assess their structure, because you do find conditions where there's a problem perhaps in the ankles or the knee or the pelvis or the lumbar area, which is creating tension through this myofascial line, and then a person gets symptoms in the neck and the shoulders, and then that may translate into occipital headaches. Okay, so I do see this. It is somewhat common that a person will have a problem in their structure from the pelvis or the lumbar area or down, and then that's causing tension through this myofascial line, and the symptom is landing here in the neck and then leading to occipital headaches. So what looks like a cervicogenic headache may actually be related to a structural problem below. And I think that's partially why these points here in the Achilles tendon can also be used for treating problems here, is because if there is a structural problem there, and then we do the local points, like the Achilles tendon points or the 7 tigers, and that helps to address the structural element that's present, then that can lead to beneficial results through the whole myofascial line. The last point here reads, add some ear points in the greater auricular nerve or the lesser occipital nerve regions, and note that the cervical spine region on the traditional ear embryo map also corresponds with this. We've already spoke about that, so be sure to use those ear points when needed and when appropriate for treating occipital headaches that are related to cervical problems, because angling the treatment from that perspective of using the ear points is precisely what some people need. And through the years of using these techniques, I've found that by adding those ear points, it was able to take the client to the next level of health and recovery. That's all I have to say in this section. I hope that you found something valuable in it. And if you have any questions or comments, feel free to write me at any time. I'm happy to discuss case studies with you and to answer any questions you may have about this material.